Good morning, good afternoon, and good evening to all our esteemed speakers and valued participants from across the globe. We welcome you to the second in our three-part dialogue series, Combat Malaria in Africa, Lessons and Opportunities. I am Alex-Okoh, Director of CAMA GBCHealth. CAMA is a unique coalition of companies working together to drive impact and end malaria in Africa. We do this in part by creating platforms like this to learn from each other, to share experiences of what works, and to collaborate on solutions that generate tangible results and impact. We would like to thank our supporters, Access Bank, Chevron, Vestergaard, and other CAMA members, including ExxonMobil, Aliko Dangote Foundation, Nigerian Breweries, and Bayer. And special thanks to our esteemed speakers for joining us today. The rich and distressing consequences of malaria in the world, especially in Africa, in the African continent, is well known. Malaria represents a clear danger to health, well-being, and economic growth and prosperity of the continent and its people. As the world continues to respond to COVID-19, it is critical to maintain momentum against malaria to ensure lives are saved and progress is not lost. The COVID-19 pandemic presents numerous challenges, but it has also presented opportunities to take stock, adapt, and innovate. Today, you will hear country and regional perspectives of where we are in the fight against malaria. You will hear some of the challenges identified due to the impact of COVID-19, lessons learned, and opportunities for partnerships and innovation that can have a lasting impact on malaria elimination. CAMA and partners are also proud to announce the launch of the End Malaria Project. This initiative aims to catalyze private sector and other partnerships and investment to significantly reduce malaria burden in high burden communities across Africa, starting with Nigeria. We can no longer simply aim for control. We need to focus on malaria elimination with a firm belief that not only is this possible, but will be a reality in our lifetime. Before I proceed, I have a few logistics notes to go over. First, if you have questions or comments, please feel free to send it via the Q&A chat box during the panel session. We will respond to your questions accordingly. Secondly, today's event will be available on YouTube in the coming days. A link to the recording will be shared with all those that are participating and that have registered. We also encourage you to share comments and insight from today's event on social media using the hashtag Combat Malaria and hashtag Invest in Malaria. So without further ado, I'm pleased to introduce Leslie Ann Long, who is the president of GBCHealth, for our welcome remarks. Leslie Ann, over to you.
Thank you, Alex-Okoh, and hello, everyone. I'm hearing from colleagues that we have people joining us from all over the world. So I'd like to add my thanks and welcome to our distinguished speakers, our CAMA partners and event supporters, and to all of you joining us as global citizens, wherever you are in the world. We are delighted to see you. My name is Leslie Ann Long, and I'm the President and CEO of GBCHealth. CAMA is a GBCHealth initiative, and we're pleased to be hosting this dialogue series with partners to mobilize the private sector, governments, and other critical actors in the global health community towards continued commitment to and increased investment in malaria elimination. Ending malaria is an ambitious vision, and in the context of COVID-19, the challenge is stark. Getting to a malaria-free world with countries under pressure to recover from COVID will require adaptive measures, innovative solutions, and a united effort across multiple organizations, from governments to civil society, from health scientists to public health specialists, from the private sector to foundations and others. The pandemic has massively disrupted health service delivery, impacting and in some cases reversing the progress made in the fight against malaria in low and middle income countries. Maintaining and even accelerating progress and momentum demands bold thinking, determined coordination, and collaborative action. It's an effort that calls for targeted community engagement, smart health workforce development, and evidence-based approaches supported by proven technologies and health data science, together with the political will and funding to drive action. This CAMA series has the broad theme, Investment in Malaria. Our CAMA partners and the private sector more broadly have been indispensable stakeholders in the malaria effort, with businesses raising funds, supporting national malaria strategies, and investing directly in malaria eradication efforts. But investment is not only about dollars, naira, and shillings. Investment is also about bringing intellectual capital and technological capabilities to the challenge, and a willingness to engage in new ways to help scale up malaria control, diagnosis, and treatment efforts across affected countries. Today, you'll hear from speakers who provide country and regional perspectives on tackling malaria. You'll hear about trusted, effective approaches that are working now and could be scaled up. And you'll also hear about some promising initiatives emerging in response to health system challenges that have manifested since the beginning of the pandemic. So enough of the welcome remarks from us. It's now my pleasure to introduce you to our first speaker. Mr. Roosevelt Ogbonna, Group Deputy Managing Director, Access Bank, is stepping in on behalf of Mr. Herbert Wigwe, CEO and Group Manager of Director of Access Bank and Co-Chair of CAMA. Access Bank has long been committed to tackling the devastating impact of malaria. The Private Sector Health Alliance of Nigeria and Access Bank launched the Malaria to Zero initiative as an innovative financing platform to galvanize private sector resources and capabilities for sustained support towards averting at least 1 million malaria cases and deaths, and to complement the Nigerian government's effort in achieving its malaria elimination goals. Roosevelt, with the clear vision that you bring on the importance of investing in infrastructure for sustainable health outcomes and ensuring that everyone has a voice at the table, your perspective on how to fight malaria in the context of a shattering pandemic, and at the same time remain optimistic that it is a challenge which can be met, you will provide the framing that we need to begin our conversation today. Roosevelt, welcome, and over to you.
Thank you very much, Leslie. It's a pleasure to be here amidst strong partners in CAMA. Let me start firstly by acknowledging the Minister of Health of Nigeria, Dr. Osagie Ehanire, also the Executive Director of the Global Funds to Fight AIDS, Tuberculosis, and Malaria, Mr. Peter Sands, and an ex-banker himself. Distinguished ladies and gentlemen, good afternoon. As Leslie has stated, I'm representing Herbert, who is also the co-chair of CAMA, and he has a speech which I'll deliver on his behalf. And it reads thus: it's my pleasure to welcome you all to this event. Whilst this is not the setting we are used to or had hoped for, I'm honored to engage you today in my capacity as CAMA co-chair. In the past year, CAMA has made significant efforts together with our members to make the world healthier and malaria-free through collaboration. The COVID-19 pandemic has had an unprecedented impact on people, society, and the economy. It makes our mission as CAMA more relevant, even more than ever before, and our members are highly motivated and are taking great strides and strength in providing support for malaria programs across Africa. This remains a top priority for CAMA. In all fields of endeavor in life, there's a need to always take stock of where we've been, where we are, and of course, where we're going to. Healthcare and malaria will be no exception. I think on a day like the 25th of April, when we celebrate the World Malaria Day, it gives us yet another opportunity to take stock on how far we've come, the lessons we've learned, and as Leslie stated, the opportunities that we have to continue to make real impact in reducing malaria and its impact on the continent of Africa. When Access Bank first became involved with CAMA, our focus was merely on giving back to our communities through this platform. But with the advancement that CAMA has made over the past few years, our goal is now to contribute towards the development of the healthcare sector through policy advocacy, collaboration, and high impact intervention as it pertains specifically to malaria. I think there are certain lessons we've learned in combating malaria across Africa, and it affects four critical things. First is access to medical care, particularly for the most vulnerable within the African subcontinent, in the rural and suburban communities. The other is around affordability, just because of the economic impoverishment that you find in many parts of Africa and the inability of the indigents to be able to afford proper health care. The third is around the efficacy of the drugs and insecticides and resistance that are being built on these drugs across many parts of Africa. This has presented a major setback in the fight against malaria. And I think the third is around communication, how we tell the story to engender the support that we need both from the private and the public sector. If there's anything our experience has shown us over the course of the last few years is that these problems in themselves are not surmountable and there are many opportunities that COVID and the backdrop of the last 12 to 18 months kind of suggest in the fight against malaria. I think the first thing is around technology. We've seen the work that many technology companies, fintechs, are doing towards providing alternative perspectives on how we look at healthcare, either in terms of affordability or access to healthcare in itself. And then this innovation and technology is making it cheaper for healthcare to be accessed and easier to take healthcare to the most remote parts of the African continent. The second is around public-private partnerships. We see that it's not possible for the private sector to do it, or the public sector to do it alone. There's need for private sector to galvanize capital and the entrepreneurship drive and spirit that is required to move any enterprise forward. And healthcare will be no different. So working together with stakeholders and partners within the healthcare industry is something that we think will galvanize and accelerate the fight against malaria within the African continent. I think thirdly, and for us quite important as well, is storytelling. There's been a lot of storytelling around COVID, but if you just compare the data between COVID and malaria, it speaks volumes. Taking 2018 data around malaria, about 155 million people were infected in 2018 in Africa, compared to 4.5 million people infected with COVID. There were about 120,000 deaths in Africa arising from COVID versus 400,000 deaths we saw in 2018 on malaria itself. But the story is not being told as effectively as we should. And Access Bank is using its platform through its own social media handle and our corporate website to help tell the malaria story. So there's a lot more focus on malaria. I think the final thing that we've learned and the opportunity we find is that a platform like CAMA gives private sector and many individuals who are looking for how to give, but don't have a structure or a platform to be able to do so. Our work with UNICEF and Guards Polo suggests that if you create a platform that is reasonable and makes it easy for the private sector and public and private individuals to give and direct their corporate social responsibility, they will be triggered to do so. As Access Bank, we have a 12 African country presence, and it's growing. By the end of this year, I think we'll have about 15 countries in which we operate in across the African continent. And we have real life direct experience in seeing the impact that healthcare and malaria has on doing business in Africa. So we're not doing this because it's just nice to give. I think it makes sense for the economic growth and development of Africa for CAMA to do the work that it's doing in fighting malaria and other diseases that exist within the African continent. So we're committed to partnering with the public sector across all the countries that we operate in. We're committed to CAMA and the fight against malaria. We're committed to using the Access Bank platform and the stakeholders that we've developed over time in bringing and driving funds and investment into healthcare to fight malaria and other diseases, particularly tuberculosis as well as HIV. I think the fight against malaria is something that CAMA has done an excellent job in, but as we look ahead, we believe that there's so much more that is possible. It's our belief that the next decade for Africa will be one of significant transformation as we leverage technology to solve some of the healthcare problems that Africa faces. I think this will be done through employing data science and precision medicine to be able to solve several of those problems. I think COVID in itself will help accelerate the conversation. It's meant that There's significant transformation around healthcare. Who would have imagined that what typically would have taken 10 years to develop a vaccine, the world was able to do in less than 12 months, just because the story was told differently. We worked together. COVID has shown that if we put our minds and our hearts and our resources together, several breakthrough opportunities can happen in healthcare, and malaria will be no difference. We need to also raise the standards, the healthcare standards that is adopted across Africa. And this we will charge both the public sector and private sector in the work that they do together. I think as Access Bank, we're committed to this, not just providing financial resources, but I think more importantly, providing a voice for the fight against malaria across Africa. I look forward to a very interesting session in the course of today and onwards. And as I said at the start of the presentation, is our mission. And our mission has never been more relevant today than ever before. And we're energized by our purpose, and we'll continue in our fight for a malaria-free Africa, working with partners across the world and with leveraging the CAMA platform specifically. Thank you for your attention, ladies and gentlemen, and it's our pleasure to be part of this session. Thank you very much.
Thank you so much, Roosevelt, for that very energizing beginning to our summit today. And I'd like to thank you also for pointing out the opportunities, as you say, regarding the role of technology and health data science, and the importance of public-private partnerships, and the critical importance of really telling the story of malaria. With that, I'd now like to turn to Dr. Alex-Okoh. She is the Director of Public Health Nigeria and is representing the Honourable Minister of Health because he was called away to attend a National Assembly meeting. Dr. Alex, we greatly appreciate you taking the time to join us at short notice and to share with us your vision for the fight against malaria and the importance of investing in achieving elimination of the disease. Dr. Alex, over to you.
Thank you very much. Good afternoon, everyone. I bring you greetings from they can't hear? What am I supposed to do?
Sure, please.
We can hear you.
Yes, thank you. I bring you greetings from the Honourable Minister of Health, whom, like you said, is unavoidably absent and has directed that I represent him. And so I will be reading his speech as follows. It gives me great pleasure to be present at this significant virtual event organized as part of the events leading up to the commemoration of 2021 World Malaria Day. I must remind you that malaria is still a disease of public health importance. It is a major cause of morbidity and mortality in our country. It is common knowledge that Nigeria alone contributes 27% of the global malaria cases and 23% of global malaria deaths based on data from the World Malaria Report of 2020. However, over the years, we have ensured intensive and dedicated program implementation across the country that has brought a reduction in malaria prevalence from 42% in 2010 to 27% in 2015 and 23% in 2018. I must add that other malaria indicators have experienced similar improvements. These include increase in percentage utilization of LLINs by under 5s from 43.4% to 52% in 2018. Increase in percentage utilization of LLINs by pregnant women from 49% in 2015 to 58% in 2018, an increase in percentage in access to IPTs from 37.2% to 40% in 2018. To ensure that we continue with this progress in the face of the current COVID-19 pandemic, we have continued and sustained malaria interventions across the country. To do this, we had to develop a business continuity plan, ensuring that implementation processes align with current global practices aimed at containing the spread of COVID-19. We are committed to a reduction of the malaria burden in the next 5 years to a parasite prevalence of less than 10% and reduce mortality attributable to malaria to less than 50 deaths per 1,000 live births by 2025, as reflected in the new malaria strategic plan for 2021 to 2025. I am delighted to note from the 2020 World Malaria Report that in the Africa region, malaria cases per 1,000 population at risk has shown a decline from 362.8 in 2000 to 225.2 in 2019. Similarly, deaths per 100,000 population at risk reduced from 121.1 in 2000 to 40.3 in 2019. Additionally, several countries in Africa have witnessed lower numbers of malaria cases. Some of them include Gambia, Mauritania, Eritrea, Equatorial Guinea, Gabon, Zambia, Central Africa Republic, Liberia, and Togo. These data point to the fact that Africa can drastically reduce the malaria burden in the region. Permit me to add that malaria affects household incomes and other associated costs, as was evident in the study among the poorest Malawian households in 1992 by Vector-borne AS, which showed that household incomes, direct and indirect costs associated with malaria, including lost work days due to illness or care for sick family members, reduced productivity and costs of health care, accounted for 32% of annual household income. This is indeed an excruciating burden, and this experience is similar across several parts of Africa. Given this background, I call on all Africans, the public and private sectors, rich individuals, business moguls, to join hands to change this narrative. I am impressed with the theme of this year's World Malaria Day celebration, which is Zero Malaria, Draw the Line Against Malaria, and the slogan, Stand Up, Take Action. The theme of this year is on empowering communities across various countries to take ownership of preventing malaria and ensuring adherence to approved diagnosis and treatment guidelines. Consequently, I call on communities, the private sector, implementers, individuals, and governments in Africa to play very definitive roles in ensuring significant changes in the malaria situation in our countries and continent. It should be noted that global malaria reduction and elimination will bring about gains in economic output worth about $208.6 billion over a 23-year period based on modeling by Barofsky J, Anekwe TD, and Chase C in 2015. Therefore, malaria elimination is both economically beneficial and financially favorable to the African economy. It is my pleasure to recommend very coordinated local resource mobilization and increased funding to enable us to eliminate malaria in the shortest possible time in Africa. Finally, may I use this opportunity to thank the Corporate Alliance on Malaria in Africa, CAMA, for organizing this very relevant and timely virtual event. CAMA over the years has galvanized private sector support for malaria elimination in the country. Also, I congratulate CAMA for the launch of the End Malaria Project today, an initiative aimed to mobilize private sector resources and capabilities for sustained support towards reducing the incidence and prevalence of malaria in the most endemic regions in Nigeria by 2023. I am indeed grateful to the Malaria Partnership in Nigeria for their continuous support to malaria elimination. I call on all to stand up and take action. I wish you all a very fruitful event. Thank you. God bless you.
Dr. Alex, thank you so much for those inspiring remarks and for sharing with us the renewed commitment for Nigeria in your launch to the new national strategy, and also for your very powerful call to action and the need for coordination and cooperation, investment, and telling that story and changing the narrative. Thank you. I'd like to turn now and welcome Peter Sands, Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Peter, a new report published by the Global Fund earlier this month provides a snapshot of the extent of the disruption caused by COVID-19 on health service delivery and the impact on malaria in low and middle income countries in Africa and Asia. We know the Global Fund partnership mobilizes and invests billions of dollars a year, and that you work closely with government, civil society, technical agencies, private sector, and others. We look forward to hearing from you today on how the Global Fund is challenging the barriers currently facing due to COVID, and how you're embracing innovation to continue the fight to end malaria. Peter, over to you.
Thank you, Leslie, and thank you to GBC and the Corporate Alliance for Malaria in Africa. And it's a privilege to be speaking alongside Roosevelt Ogbonna and Dr. Alex-Okoh. World Malaria Day is an opportunity for all of us in the malaria community to remind the rest of the world that as we battle with COVID, we still haven't beaten this much older pandemic, a mosquito-borne disease which has plagued humanity for literally thousands of years and still kills over 400,000 people per year, mainly children. In fact, and I'm just going to close my door. With apologies, I have a dog that is very good at opening doors and very bad at closing them. The malaria killed over 400,000 people in 2019, but the grim fact is that it probably killed more in 2020 and probably will kill more again in 2021, because COVID-19 has severely disrupted malaria testing and treatment services in many of the most affected countries, and including mainly in Africa. And as you mentioned, we conducted a survey of over 500 healthcare facilities across Africa and Asia. And that revealed, and it's just a survey, so it's not total data, but it's across a large sample, revealed a 31% drop in malaria diagnosis. Now, since all of you know, swift diagnosis and treatment is the key to preventing malaria cases resulting in death, and we really have no reason to believe that cases have fallen in number, such a sharp reduction in diagnosis was almost inevitably translate into increased mortality. Now, actually, it could have been much worse. The first line of defense against malaria are insecticide-impregnated bed nets, indoor residual spraying, ways of controlling mosquitoes from biting people. And when the pandemic first hit over 12 months ago, we and others were extremely concerned that supply chain disruptions and lockdowns would mean that we wouldn't be able to do bed net campaigns, and that millions of people would thus be unprotected. And I actually think the malaria community came together really impressively last year. National malaria campaigns, partners such as the Global Fund and the United States PMI, Presidential Malaria Initiative, huge engagement of community organizations and civil society organizations working together, being really innovative, adaptive, and preventing what could have been a catastrophe. While some bed net distribution campaigns were delayed, and some quite significantly, almost all of them were actually successfully implemented. Of course, though, the challenge isn't over. COVID continues, the disruption continues, and this year I think we face a particular challenge around sustaining community health workers' ability to test and treat. In much of rural Africa, and particularly in the countries in which the malaria burden is highest, community health workers are the linchpin of the healthcare system, of the rural healthcare system. And much, if not most of their time is spent diagnosing and treating malaria cases. But given the number of people they interact with, community health workers are themselves extremely vulnerable to being infected with COVID-19. And sadly, they often have limited access to personal protective equipment, to PPE. And if one falls ill, there's often no backup. While we don't have reliable data on infection rates among community health workers, in general, health workers, which represent in most countries, and Africa at the lower end of this range, 2 to 3% of the population, in most countries, they represent somewhere between 14 and 35% of COVID-19 infections. Health workers are much more vulnerable, and so we need to protect them. We should also recognize that community health workers are going to be called on to play a vital role in COVID-19 vaccination campaigns. It's crucial to protect people from the virus, but we also need to be careful that diverting them to this vital task doesn't lead to an escalation in malaria deaths. Unless we manage this very carefully, protecting community health workers, ensuring that they're capacitized to support the COVID-19 vaccination and sustain malaria diagnosis and treatment, we may well face a situation where the knock-on impact on incremental malaria deaths in the highest burden parts of Africa exceed the direct impact of COVID-19. Now, as the largest funder of malaria programs worldwide, the Global Fund is acutely conscious of the scale of these challenges and is working urgently with partners to prevent such a disastrous outcome and get us on track, back on track towards our ambition of ending malaria. From January of 2021, we increased malaria grants by 23% on average. And this year, we're committed and are committed to deploying about $4 billion in our malaria grants over the next 3 years. In addition, our COVID-19 response mechanism is providing at least $3.7 billion in funding to help countries respond to COVID-19 and to mitigate the impact on HIV, TB, and malaria services, and to make urgent fixes to health systems. For malaria, the priorities in 2021 are to continue to ensure that mosquito bednet campaigns and spraying and provision of chemo prevention are maintained, and to step up support to community health worker networks. We need more community health workers, and we need to support them better, financially, with technology, with training, and with personal protective equipment. As we look forward, I do think that we should use COVID-19 as a catalyst to rethink our approach to malaria. We should all be uncomfortable, more than uncomfortable, outraged by the fact that we're continuing to let 400,000 people plus die a year of a disease that we know how to treat and we know how to eliminate because we have done so in many countries. For the private sector, COVID-19 has been a massive lesson in the economic impacts of infectious disease. But we are better at recognizing this when it's a downside than when it's an upside. But I would argue that the upside of getting rid of malaria is of the same scale and impact as the downside we've experienced from COVID. If you look at and there've been various analyses, the impact on tourism, on agricultural productivity, on educational attainment. If you take malaria away from communities, they become economically much more productive. I also think the private sector has a huge amount, and the earlier speakers have referred to some of these areas to offer in terms of skills and capabilities and leadership. We, as the Global Fund, work with a number of different partners. We have Nando with the Goodbye Malaria project, Coca-Cola with the Last Mile, Rockefeller on data science. And what we see is the energy, the skill sets, the capacities that the private sector can bring. And I would really encourage private sector players to get behind CAMA and to bring their skills and capabilities to this fight. More generally, and this is my final point, the world is already beginning to discuss how we make us all better protected from future pandemics. And these debates are unfolding in the G7 and the G20 and so on. But my point here would be, while we worry about future pandemics, let's not forget the imperative to finish the fight against the oldest pandemics, like malaria. And that makes sense not just from a moral point of view, but from a pragmatic point of view. The capabilities needed to prepare and respond to any new pathogen are largely the same as we need to defeat malaria. Primary healthcare that reaches everyone, however remote, rapid diagnostics, genomic sequencing to detect variants, disease surveillance, including the ability to trace individual infections, supply chains that ensure essential medicines get down to the very last mile. So rather than predicate an effort to make us better prepared against pandemics on sort of hypothetical threats, pathogens that might cost lives, I would argue that we should build our protection by beating malaria, by building the capabilities to beat a disease that is costing lives, so we can simultaneously make the world better protected against future pandemics and save millions of lives, but of children and young women in particular, from malaria. So for too long, we have accepted people dying of a treatable disease we know how to get rid of. Now we should make this happen everywhere, and in doing so, reinforce our defenses against other pandemic threats. And I'd really like to thank GBCHealth and CAMA and really encourage the private sector to engage in this. This is a real opportunity it's a huge challenge, but it's a real opportunity to turbocharge the fight against malaria. Thank you.
Peter, thank you so much for those impassioned remarks and reminding us, the critical role that community health workers have to play and the support they need to stay safe, and the balance of them in both being critical in the vaccination against COVID, but at the same time maintaining that focus on malaria, and for really ending there on that moral and pragmatic imperative to continue the fight against an old pandemic at the same time as preparing ourselves for potential future pandemics. So I'd like to end this first session by saying thank you again to all of our distinguished speakers. We appreciate your time and the thoughts and the opening remarks you've provided, the challenges you've set, the optimism that you've brought in framing this opening session for the rest of our summit. We're now going to turn to a very short video, and then I'm going to hand back to Achuko to moderate and facilitate the rest of this conference. Thank you very much, everybody.
Hi, is anyone home? Hi!
Bintu, is that you? I'm at the backyard, come over.
Sis, why was the front door open? Wait, why are you pouring water on my nephew's head? And what's that greenish substance you're giving him?
He has malaria. I'm sure it's malaria, not COVID-19. So I mixed some leaves too.
Why? That's wrong, sis. Let's get him dressed up. He needs to be tested, and if the test is positive, he'll be given malaria drugs. And if it's COVID-19, he'll get treated too. Malaria is a life-threatening disease caused by parasites transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. With 229 million cases and 409,000 deaths in 2019, malaria is a health security crisis that places a huge strain on half the world's health systems, exposes gaps in basic health services, undermines economies, and devastates families and communities. In 2020, fragile health systems faced the dual burden of preventing malaria cases and combating over 225 million malaria infections and managing new COVID infections. As the world continues to respond to COVID-19, it is critical to maintain momentum against malaria to ensure lives are saved and progress is not lost. Ridding the world of malaria will lead to healthier, more resilient communities that are better able to thrive, prosper, and confront new health challenges. Invest in the fight against malaria. This message is brought to you by the Corporate Alliance on Malaria in Africa.
Thank you, panelists, for joining us. So my first question goes to Dr. Kalu. With the current state of malaria in the world, and especially amidst the COVID-19 pandemic, a lot of people have been asking questions. Where are we in terms of status of malaria? Are we on the verge of achieving our goals? Are we on track? What is happening? So I would like for you to talk about, share with us the status of malaria in Africa, where we are towards achieving the World Health Organization's Global Technical Strategy for Malaria 2016 to 2030. Dr. Kalu, over to you.
Thank you, Okoh, and it's great to join this platform to discuss malaria, a subject very close to my heart. To start with, Africa is off target. Africa is off track towards achieving the 2030 Global Technical Strategy targets for malaria, which is at least 90% reduction in malaria incidence and at least 90% reduction in malaria mortality rate. Africa is off track. In fact, the 2020 milestones were not achieved. The 2020 milestone was 40% reduction of malaria incidence and 40% reduction of malaria malaria mortality. And Africa was off track by 37% for malaria case reduction and by 25% for malaria mortality. In Africa last year, we still had about 400,000 malaria deaths, 400,000. And to think that nobody's carrying placards. Every year in Africa, more than 385,000 people die from malaria, and we are just okay with it. It is unacceptable because malaria is preventable, malaria death is preventable. It cannot continue like this. Yes, I would like to congratulate our governments and people and health workers and families for the giant strides that have been made on malaria control in Africa. In the last 20 years, since the year 2000, following the Abuja Declaration on rollback malaria, there has been tremendous progress, nearly 30% reduction in malaria cases, and 60% reduction in malaria deaths. That is extraordinary. Africa has made a lot of progress, but more needs to be done. Last year, there were more than 215 million cases of malaria. This is preventable. This is treatable. Nobody should die from malaria. And this progress has been due to expansion of services. Yes, we are proud that between 2000 and 2019, we have increased access to insecticide-treated nets. It has gone up from as low as 5% in 2000 to 68% ownership of one net in Africa. That is great. That is very commendable. Sleeping under insecticide-treated nets has also gone up from as low as 3% in the year 2000 to 52% in the year 2019. This is great progress. 80% of people that presented at health facilities received appropriate malaria treatment. This is great in Africa, but more needs to be done because we are far from achieving the target. We are off track, and there is need to ensure that everybody, wherever they live or work, has access to malaria treatment and malaria prevention. We need to do more. I know there are challenges. We have, for instance, like mentioned by the Honorable Minister, as well as by Ogbonna from Access Bank, we know there is the problem, the challenge of increasing insecticide resistance in Africa. Yes, it is there, but we need to hurry and ensure that we use available tools to make sure that nobody comes down from malaria and nobody dies from malaria. Yes, we know there are invasions of new biological species of the parasite of the vector in the Horn of Africa. Again, that is a threat. The Anopheles stephensi. We need to work towards containing that. We know there is threat of artemisinin resistance, so that the medicine used to treat malaria becomes ineffective. We know that. Again, it calls for appropriate investments to make sure that these things are contained and that we march forward towards the malaria-free future we all desire. Therefore, moving forward, we need to work differently to achieve a different result. Being off track means we need to change the way we work. Each country must look into its own situation and ask themselves the question, what is working? What is not working? What do we do differently to achieve a different result? From the World Health Organization, our recommendation is that we must use existing data. Use existing data on malaria prevalence in your country. Use existing data on access to malaria interventions, and also existing data on access to health services. When you use these three sets of data, you'll be able to map malaria in your country at the district level. And when you do that, then you can tailor your interventions to target malaria in a precise way where it is in that country, where it is in that district. Also, you'll be able to know the communities or areas of the country who are left behind and target them with appropriate interventions. We believe when we begin to stratify and target interventions in this way, we'll be able to achieve more with available resources. Also, we need new tools. We certainly need new tools to catch up and to expand the impact of available tools, new tools like malaria vaccines. And we are happy that the pilot implementation of the RTSS vaccine is going on well in Ghana, in Kenya, and in Malawi. And we just hope that by the end of this year, there will be a positive WHO recommendation on use of this vaccine. Because we have seen that in the last 2 years, over 650,000 people, children, have been vaccinated with the first dose of the vaccine. And so we are optimistic that this vaccine may be that additional tool that is able to reduce malaria cases and also reduce malaria death in Africa. Again, our leaders must rise like they did in the year 2000. It is time for Africa's leaders to show again that African leadership is what the world needs to go to a malaria-free future. In the year 2000 in Abuja, African heads of states and governments gathered and they passed the resolution on rollback malaria. That created the momentum towards a malaria-free future. Because we are now off track, because we are now lagging behind, African leaders must rise again and provide leadership and regenerate the momentum towards the future that we desire, a future without malaria. Thank you very much.
Thank you, Dr. Kalu, for that. It's a great speech, very inspiring. I totally agree with you that it's unacceptable because malaria death is preventable. It's unacceptable that we still have the number of cases that we have. And you actually painted a true picture of where we are and what we need to do moving forward as a continent to get to our desired goal. So turning into our next speaker, Dr. Aimable, Dr. Kalu mentioned progress that have been made and also the gaps and where we need to make progress. I know Rwanda is a country that has done so well, that's made a giant stride in terms of getting towards malaria elimination. So we would like to hear from you to share with us Rwanda's progress in the fight against malaria and how Rwanda has leveraged existing systems to address both COVID-19 and malaria, the challenges and opportunities that we can learn from. Go ahead, Dr. Aimable.
Thank you. Thank you so much, Ochuko, and thank you, Dr. Kalu, for highlighting these key points. And Rwanda, of course, is among those countries of track, but I'll be sharing with you some experience from Rwanda to see where maybe many countries are facing challenges. Rwanda recorded malaria upsurge in 2016-17, where the country registered over 4.8 million malaria cases in 2017, with 18,000 severe malaria cases and around 700 deaths due to malaria in 2016. Some factors that were identified include mosquito resistance to insecticide, and I think Dr. Kalu said it well, because Rwanda has been using pyrethroid for spraying, but also you know that all bed net use are treated with pyrethroid. And Rwanda documented that clear resistance countrywide. Another factor behind this is low coverage in key interventions, including IRS, but also some climate change factors like rainfall, temperature. But recently, Rwanda, we documented mosquito biting behavior change. Now mosquitoes are biting outside. And all our interventions were targeting indoors only. And also with the increased irrigation areas, mainly for rice plantation areas, this also contributed to increased water bodies, and mainly in the southern and eastern province of the country. In response to that, the government of Rwanda put in place malaria contingency plan, calling all key stakeholders, Ministry of Agriculture, but also other ministries, and also local leaders, private sector, to join their hand in the fight against malaria. And through efficiency and data use, and once again, Dr. Kalu said it, stratification of the epidemic guided Rwanda in decision making, and we could also mobilize funds from PMI and the Global Fund to deploy key interventions. And we could at least sustain IRS and extend it in all 12 districts, where we are recording more than 70% of the national malaria burden countrywide, and addressing mosquito resistance to pyrethroid as well, because mosquito bed net alone would not address mosquito resistance, and you had to add IRS as an effective intervention. We also negotiated a fund from PMI, and of course, with the Global Fund support, we could now receive new generation of net to address mosquito resistance where we could not deploy IRS. And recently, we have introduced PBO net and G2 net in around 90 districts of Rwanda, where we could not afford IRS as a high impact intervention, but very costly. We have also scaled up home-based management of malaria at community level, done by community health workers now. Before it was only for under 5, and currently it is being implemented in all ages and in all districts. And currently, community health workers are managing 56% of all malaria cases nationwide. We have also introduced technology using drones for larviciding, targeting young mosquitoes before they reach people in their houses. And because mosquitoes were biting outside, you understand that people may get bite outside. Now we are using drones for larviciding, but also using mosquito repellent product to protect people outside. And this is supported with the private sector in our country. And recently, we have deployed 5 civil society organizations in all 30 communities and local leaders to ensure that at least they are engaged in malaria control as well, and mapping hotspots for malaria to target interventions. With all this combined effort, we have recorded a drop in malaria incidence from 400 per 1,000 to less than 150 in 2020. Morbid mortality, it reduced from 700 to less than 150 in 2020, representing around 78% reduction. I think these are just key evidence that some intervention can work in Rwanda, but of course, we had to work using existing services and systems to address the COVID pandemic challenges on the malaria program, because the first case of malaria was recorded in March 2020, and we had just started mass campaign of distribution, and we had to use community health workers to ensure that we change the design, now using household distribution rather than gathering people for distribution of need. I think this is just a typical example, and of course we have challenges, how to sustain those effective interventions while they are costly, but also how to address the workload of community health workers, because they are already managing all cases, but they are volunteers. And opportunities are there because from COVID pandemic, we learned that community health workers, well equipped, can address both diseases. And I think from Rwanda, we are happy that we can use existing systems to address both malaria and the COVID pandemic. And thank you so much for your attention. Over to you.
Thank you, Dr. Aimable. You mentioned some very salient points on what has worked for Rwanda. You mentioned efficiency of data use, stratification, which Dr. Kalu also mentioned, tailoring interventions to country, using of efficient use of health workers, and using an integrated vector control management, which is very key, which includes the use of bed nets, IRS, and other components, and technology as well, is one of the things you've used. So thanks for sharing with us. I hope that Rwanda will continue in this good path and even do better in the coming days to come. So my next question will go to Dr. Patrick. In same vein, what we've heard from Rwanda, we would like to hear from you Ghana's progress in the fight against malaria, and how Ghana has leveraged existing systems to address both COVID-19 and malaria, the challenges and opportunities. Over to you, Dr. Patrick.
Thank you, and good afternoon all. I think it's an honor to be here to share our experience as the world battles COVID-19 amidst the already existing issues such as malaria, which is the topic we are discussing. I also want to congratulate CAMA and all our partners for keeping high the malaria discourse. And the private sector partnership are very critical as far as these events are concerned. Ghana, like what Dr. Kalu said, is part of the country that probably as Africa, we are a bit off track But we have made some modest progress in the fight against malaria. Our malaria case fatality rate for children under 5 has reduced from 0.32 in 2016 to 0.12 in 2020, while the malaria parasite prevalence among children under 5 has also reduced from 20.6% in 2016, the same year, to about 14.1% in 2019. Nevertheless, malaria still remains a major public burden in Ghana, accounting for about 20.5% of our outpatient attendance and about 18.2% of inpatient admissions. Malaria is endemic and is perennial in all parts of Ghana, all regions of the Ghana, and it's all seasons we have malaria in this country. Ghana is still in a control phase in the fight against malaria. Our goal for the National Strategic Plan for Malaria, that's from 2021 to 25, is to reduce malaria morbidity by 50% and mortality by 90% based on our 2019 figures, and to have at least 6 districts in the country in the pre-elimination phase of malaria control. These are the areas that we are doing a lot of activities, including indoor residual spraying and seasonal malaria control. Ghana has recorded our first COVID case on the 12th of March, and as at the 14th of April, that's the last data I'm trying to capture for you, we had recorded about 91,000 cases. 97.7% have recovered, and we have recovered, and about 0.8% is our case fatality rate. So we've so far lost about 771 patients to COVID. Several strategies, including the routine surveillance, enhanced contact tracing, and quarantine, isolation, screening, international travelers, sort of to block importation of the disease, and all the strategies we have adopted against COVID. What our president, who is the lead in the strategy, looked at is that we need to have an all-society and all-sector approach to fighting COVID. And I believe that this is something that we can transfer into malaria. This has actually helped to limit our virus negative impact on the country, but we've already gone through 2 phases of a flare-up, and we just ended the second wave of COVID-19. We are hoping that with vaccination, we might be able to sort of avert a third wave. Ghana, we prepared a contingency plan to ensure continuity of service very early in the pandemic, and this has been implemented to the core. So though there was generally, we saw less people coming for the health in the first peak of the COVID-19, the service still prevailed, and at the end of the year, we were able to catch up on most of our coverages. Specifically for malaria, we were able to do our seasonal malaria chemoprophylaxis, which is one of the major interventions. This was still undertaken with some adjustments. Meetings and trainings were held virtually where possible, whereas in instances, especially subnational, where physical meetings became necessary, all the necessary protocols were applied so that we can have our meetings. And where internet was poor, we made sure we had in-person meetings in smaller groups so that the service can continue and training and capacity can continue. Communication was enhanced during this period using social media for information across all levels of supervision for all programs. Community microphones, we used the loudspeakers at the mosques. We were also looking at speaker announcement, etc. Field workers and supervisors were adequately trained and equipped with PPEs and safety information, and ensuring effective implementation in the field. These strategies were employed for other interventions, such as the mass distribution of LNIs, and this was something we really were worried. How are we going to do this mass exercise without putting people at risk of COVID? We also were able to do a cider management. We did our indoor residual training still within the COVID and monitoring of activities of malaria sentinel sites. Malaria diagnosis training, case management trainings, and other important malaria prevention activities were still carried out. we actually had to modify which class received nets through the schools when we got to the school, because schools were closed for most part of the year, except for the final years who were going to take the exams and come back. I must say, we did face some challenges, and like many countries, human resource was a challenge. Some health workers fell sick with COVID, while others had to devote their time in fighting pandemic. There was also an increase in need for funding to fight COVID, and so people were scared. Of course, we took a lot of money off malaria and attention. Despite these challenges, Ghana has remained focused, working closely with key stakeholders and partners and to ensure effective deployment of malaria control interventions. Currently, the National Malaria Control Program is currently distributing nets countrywide using the mass campaign strategy for about 217 districts. So thank you very much. This is where Ghana is.
Thank you so much, Dr. Patrick, for that comprehensive overview of your malaria program. One of the things you mentioned that actually aligned with what we are discussing today is all sectoral approach is in the fight against malaria. Thank you for sharing that. I'll just have one more follow-up question with Dr. Kalu. There was something that Peterson said. It said we should use COVID-19 as a catalyst to rethink our approach in the fight against malaria. My question to you, Dr. Kalu, is we know that WHO is currently going through a process of rethinking malaria. Please, can you share with us what the process is about and the expected outcomes?
Thank you very much. It's true, COVID-19, maybe because of the long quarantine for 1.5 years now, we've had time to rethink a lot of things. Things we thought impossible that would be difficult, technology has made possible. And that is one of the things that COVID-19 response has taught us. So we've learned a lot of things. We've learned that you can use data to precisely define where transmission is taking place. If we can do that for COVID, we can do that for malaria. We've learned that we can develop vaccines over a short period. If we can do that for COVID, we can do that for malaria. We've learned the power of multi-sectoral response. Again, meaning all of society approach. If we can do that for COVID, we can do that for malaria that is causing 18-19% outpatient attendance, for instance, in Ghana. We've learned the power of political leadership. COVID-19 has been successfully responded to so far because it was not treated as a health problem. It was treated as a socio-economic and development challenge. Therefore, the presidents of our nations, the prime ministers and leaders took leadership. Health sector was asked to submit a response plan. Agriculture, tourism, every sector was asked to submit a response plan. And that is why so far we are successfully responding to COVID-19. We can do the same for malaria. We need to shift from malaria being a health problem and begin to see malaria as a socio-economic and development problem that needs an all of society response. That is the way to go. The corporate sector, for instance, has a responsibility to adopt a district and make it malaria-free. Agricultural sector has a responsibility to ensure that irrigation projects do not become sources of malaria transmission. Prisons and military formations have a responsibility to ensure that the prisons are malaria-free. Communities have a responsibility to ensure that there is no breeding site in that community. Everybody, every sector has a role to play. A multi-sectoral approach, a whole of society approach. So yes, we are holding the Rethinking Malaria initiative to simply answer the question, what is working, what is not working, what do we need to do differently? Countries must also have the same process and answer that question through a consultative approach. we expect a new partnership for malaria that is beyond health sector, that involves all relevant non-health sectors as equal partners. That is the way for us to program and catch up. That is the way to achieve the 2030 targets. Thank you.
Wow. Thank you, Dr. Kalu. You mentioned a couple of things that I just want to reiterate. Multi-sectoral response is important, which Dr. Patrick said. And then you said we need to shift from malaria being a health problem to a socio-economic problem. That is the hashtag on its own. And I believe that if we can work with that mindset, we'll have the ability to achieve the result that we are striving for. We've said so much on this panel already. There's a number of things you also mentioned: political leadership, leveraging on what we've done in the fight against COVID, in the fight against malaria. There's a lot to learn from. And I'm sure that the audience, we've heard, and we all believe that different sectors are represented in this meeting, and we will look forward to working with WHO and in various countries to ensure that our rethinking process is well done and well documented, and not just documented, but get into the point of implementation. So we look forward to working with you. That said, we would like to wrap up this session. So I want to thank our esteemed speakers for your time, for your contributions and insights. You've been very, very, what's the word? Very insightful, that's the word, yes. You've given us a lot of things that would help us to think, and try to see how we can do things differently moving forward. So thank you for your time.